The information provided in this video is for research and educational purposes only. It is intended to serve as is not intended to serve as personal health care from a licensed doctor. In addition, the lay viewer should be aware of misinterpreting this material, which is prepared and edited for people in which strokes have affected. Does Stroke Life Perspective have your permission, Brenda and Larry, to use the interview on YouTube and the Facebook private group page to encourage other people?
Yes.
Yes.
Okay. All right. Now we can get going.
Okay.
Sorry.
I'm sorry to take it for a curve first.
That's okay.
You're fine. It was great. And I want to get more into it. I just want to make sure we capture it so that everybody can be encouraged. Absolutely. Because you're already encouraging me. And I'm just so thankful that our journeys have crossed. Unfortunately, it's this way, but I'm just thankful. So first of all, can you tell your audience where you guys are from?
So we are actually both from New York.
Okay.
But after Larry's second stroke, the New York climate was a little more challenging for him because he had balance and gait issues and breathing issues. So I toughed it out and we moved down to Florida, where it's 80 degrees and sunny right now. We are loving life.
Wow. Well, that I lived in Orlando area for a little bit, Clearwater. I was there for a little while and then came back to Kansas. I don't know.
Yeah, that was silly.
K-State have to represent, so.
I'm enjoying palm trees, you know.
Okay.
So it's definitely for Larry. He was trapped when it was icy and snowy out. And he always felt guilty that he couldn't help me shovel. Not that he shoveled prior, but, you know, but he felt guilty because now, you know what happens, and you're going to see this with your husband. What happens is all the things that they didn't like to do before, now that they're told they can't do it, all of a sudden they want to do it. I used to laugh at that. Go back in the house.
I do hope my husband gets to that point. He's still not where he needs to be, but you know, he's on his journey. He's on his way. So I just stay encouraged and encourage.
It took Larry a little while. When I took him home from the hospital the first time, he couldn't stand, he couldn't walk, he couldn't go to the bathroom by himself. Every time he looked up or moved his head, he got dizzy. And for the first 3 weeks, Larry had a chronic case of the hiccups. That was debilitating for him because think about it. You've had the hiccups, right? And they last 5-10 minutes and they're annoying. Imagine going 3 weeks. His whole diaphragm was affected. And then he started choking. So it was really challenging. We had a lot of therapists coming in and out of the house. And I was lucky that I'm not trained in physical therapy, but I myself have gone through enough where I'm knowledgeable enough. I knew how to lift him, I knew how to move him, and I also knew how to work with him. And I worked very closely with the physical therapist that came in, and I had him back to work in 3 months, where nobody would have known that he had ever had a stroke.
Oh my!
So even while he was in the hospital, there he is laying in ICU for 10 days. He's the CEO of 2 companies. Nobody can know that the CEO of these companies was sick and vulnerable. So he's literally laying there, basically barely speaking, and I have his laptop next to the bed, and I'm literally answering emails pretending to be him.
Wow.
Business is going. So,
wow.
So we started to, before we started recording, that, the first stroke was due, what we had seen was dizzy spells, which most people don't realize are one of the signs of a stroke. So that really threw us off. And I know that if I would have known that, we could have gotten him help much sooner, and we could have hopefully avoided the big stroke. So what they consider it is every time he had a dizzy spell, he was actually having a minor stroke, very minor. Mm-hmm. And it was like flutters that was happening, almost like mini earthquakes. And then finally one day, boom, the big one came. You know,
Larry or Brenda, did you get the shot that they have for strokes? No.
No,
So
I'm going for weeks.
What is the determining factor for one to get the shot?
Okay, so the determining factor, and it's all so crazy stupid. And again, that's why on the site that I'm going to refer you to after we're done, we did an interview with a 40-year-old woman at the time, and she was the caregiver for her husband who had serious issues. She winds up having the stroke and realizing she had the stroke. She got taken to the hospital, and the hospital told her, we can give you the shot. It's either going to kill you or it's going to help you get better. And she, like every other stroke victim, goes, I don't want to live like this. Give me the shot. So if you know you have a stroke, they can give you a shot. What they diagnosed me at the time they could have done something well was I had vertigo.
And
that's their decision. 4 hours in a hospital, and yeah, you have vertigo. We'll give you medicine. We'll send you home. So had they really guessed that it was a stroke, they could have given me whatever shot I needed, and I could have been fine.
Had they done a CAT scan with contrast as opposed to a contrast without the CAT scan without contrast, that's when they would have been able to pick up on the fact that he was having a stroke.
Well, and you know that was an MRI done, because the MRI is the one that picks up the soft tissue.
Yeah, but the MRI
that was
at midnight. Right. Well, it was at midnight after I had brought him back to the hospital, and it was too late. You only have that 3-hour window. Now you fast forward years later. I wake up one morning and I take one look at him and I go, "Oh no." I had other choice words. And I was like, talk to me. And he's like, oh. And I'm like, oh my God, Larry, you're having a stroke. And he's like, oh, fine. They don't hear that their speech is off. They don't realize that their whole face and mouth is not working. I took one look at him and I said, oh my God, I got to get you to the hospital. I immediately got him to the hospital. But when they asked me the question, how long ago did it happen? I can't answer. So now here's the dilemma. Well, if we don't know if it's been within 3 hours and we give him that shot, it could kill him. Well, I wasn't willing to take that chance. I'd rather wait and see just how bad the stroke was. He had a series of 2 strokes within a 24-hour period at that point, but I till this day don't know why when he had the second stroke the second day, why they weren't able to give him something. You're gonna have to take.
Well, we experienced that same thing when my husband had the stroke while he was in ICU, and I had no access to him at all. I wasn't even told that he had a stroke until after the fact. Nobody called me. I had called up there to check on him and was told I was transferred from the hospital operator to the ICU unit, which he was not on prior. And so when I was transferred, I said, why is he there? Because he hasn't been. He was just on the COVID restricted unit, but he wasn't in ICU. And then they shared with me that, he had a stroke at that time. And I thought, if I had a little bit of faith in the healthcare system, it totally went out the door at that point. So absolutely. I know he didn't get the shot either, which again floors me because he was in their care.
That, and they all knew that one of the issues with COVID patients was that they were having strokes.
And high blood pressure. He had through the roof high blood pressure. He was on an IV drip every 15 minutes for medication for high blood pressure. Why they did not give him the shot is beyond me. I don't know. I don't know. So anyway,
Larry had COVID in July. And he was doing really, really well. I was treating him completely holistically. But finally, at one point, I said, you know what? His oxygen went down to only 92. I said, he has a diabetic, high blood pressure, high cholesterol, heart attack, stroke, stent. I'm not screwing around. So I took him in. And they did put him on heparin for a few days, just in case.
Wow.
Yeah.
Wow.
But I was on top of things.
So Larry, do you take a lot of medications?
Oh my God, we have so many exciting stories to tell you that could be helpful for you.
Yeah.
So, yes. So first off, I want to start the story different from you. I just took him out. He refused to leave.
You tell the story.
Okay, I got the story.
Yeah.
Good. So what happened is, first off, the first place I went after I left the hospital, and this is beyond extremely important, was to someone who is called a functional neurologist.
Do you mind if I write that down, Larry? Can
No,
I
no,
take notes?
please write it down. And I don't know, I tried looking up for you to see if there was any in your neighborhood. So I'll have to put you in touch with somebody. These people who know what they're doing graduate from the Carrick Institute in Florida. And it is amazing what they do. So this guy didn't have any hospital rights. He couldn't do anything. So he had to wait till I got released from the hospital. And every day or every other day, he sat with me for half hour or whatever, 45 minutes. He then had me wait an hour and a half and did the same thing. He does things with your eyes that starts putting you back into a more equilibrium situation, for lack of a better term. And it is amazing what these people can do. Amazing. For example, and I'll give you a best example. I started with this doctor because of Brenda. Brenda had irregular heartbeats, where what happens is she starts AFib. Real common end. And Brenda's been paddled in her life. And there's my girlfriend at the time telling me she doesn't want to be paddled again. I can't take it to the hospital. But in the meantime, when your heart starts beating that fast, you have to really do something. I wind up calling this guy at home. And the next thing he did was he came in early for him to treat Brenda. In a matter of 2 visits, and he only adjusted her clerical bone and whatever, and then all eye exercise. She has never gone into AFib in over 10 years, except for one day. I got to tell you the story. One day in 10 years. Brenda never drinks coffee, never has any caffeinated beverage. There we were in Europe for high tea, and she ordered decaf tea. Evidently, they didn't give her decaf tea, so she started having irregular heartbeat, palpitations. She went off to the side and did these eye exercises
that I'm trained to do, and I do on a regular basis.
And it
puts you back right into sinus rhythm. So when Larry was in the ICU after the second stroke, I called the doctor and I said, Larry's back in the hospital. He's had another stroke. And he says, I can't treat him there, but don't even go home. You bring him straight to me. We did 2 visits a day, 3 days a week for 3 weeks with a 45-minute break in between. And just so you know, what I learned through functional neurology is, even with your husband, don't back up therapies one after another. So if he does, say, OT and then he has PT, your brain needs 45 minutes to recover in between each. So don't back things up too much. That brain has to recover. It needs to have the rest. We would just sit in the waiting room for an hour. Didn't matter. But that brain has to get the rest. And believe it or not, the most important thing is let him nap. If he tells you he's tired, let him nap. The brain needs the naps.
Okay.
So I
And
learned a lot.
yes, and we here, in Kansas, I am just not versed with the services for stroke patient, and I can't say that I'm real thrilled with what we have, the options that we have to choose from.
Right.
In fact, my husband went to one of the only stroke rehabs here in Wichita, is where we're at, um, and was there for about 4 weeks, and then he has been sent home since. And home health came in and worked with him, up until this week. This was his last week. And I tell you what, my husband was never an emotional person. He never cried before, ever. Like, he was just that solid man's man. He just didn't have emotion like that. And he cried because he wasn't going to be able to see his physical therapist anymore. And he just said, I'm not ready to let him go. So now we are like, okay, what's the next step? And I'm not sure. I know I actually own a special needs business. I've owned it for quite a few years now. So I know how to do the PT. I've hired a PT to come in and work with him, even outside of the rehab or the people that were coming in. But I'm just like, okay, what's next? And I'm sure some type of an outpatient rehab is the next step. But to find the one that focuses on neuro and stroke, it's not here. So anyway, that's something we are going to have to deal with. But
I want to just comment to help you for a second. I apologize.
Sure.
The first step is for you to properly evaluate where he is. Just putting him in a stroke rehab now could be more confusing. Like for me, the first couple of weeks, I couldn't lift my left foot. Right foot, I'm sorry, my other foot, yeah. My right foot to pick up, and they wanted me in the beginning to put a book on the ground and pick up my right foot. This went on for numerous times where a physical therapist came in. Now, it sounds stupid. It sounds like, hey, that's nothing. But for me, it's something you could do at home now and get him started if he has the same sort of situation. And I can give you other stuff like that because you don't need some outside person. There are things that your husband doesn't want the outside people. I'm more, as the person who came so far, he's beyond happy because she got him to here. The next person who comes in now, he's embarrassed. He doesn't want to start showing them that he can't do it. So it's already a conflict situation where if you could move him up a little bit along the food chain, then he's not as upset being in front of somebody. But if all of a sudden the new person tells me, here, let's see how your steps are. And they put a book down on the step and you're looking at it and, yeah, sure, this is easy. And all of a sudden it realizes it's not easy for me. Ew.
And you got that male ego.
Ego.
Yeah.
Yeah.
For you and I, if we can't do something, I mean, I know how I was when I was, had surgeries or whatever in my past. Don't tell me I can't do it. I want to show you, Larry's still 8 and 10 years later, still not at that point. He will not come to the gym with me. He's embarrassed.
Mm-hmm.
It falls. He's mortified, and he does fall. Not often, but he does.
So
Definitely
Larry,
a lot.
I'm sorry to interrupt, Brenda. When did you have your first stroke? What year?
Larry was 10 years ago, 10 and a half years ago.
Oh, wow.
The first stroke. 2.5 years later, I had the second stroke.
But we got married right before the second stroke.
Oh.
We got married in October, and then coincidentally, Larry had his second stroke on his birthday in January. So birthdays are really interesting around here.
Wow. Oh, wow. Wow. So what kind of stroke did you have, Larry? Was it ischemic or hemorrhaging or?
Ischemic. The second stroke, I know what caused it. I actually had gotten him to go to the gym. I learned something that nobody had taught me this after stroke number 1. So Larry's body is filled with plaque. Okay, high cholesterol for uncontrolled for many years. He's got at that point like a dozen stents in his chest. So what I learned is, and most people need to know this, is a stroke survivor should never lift anything more than 10 pounds. If it's an ischemic stroke, okay, if it has to do with plaque buildup, okay, again, there's so many different types of strokes. But the reason for that is when you bend down and pick something up that's heavy, you bear down. When you bear down, you get a surge of blood pressure. Well, if your arteries are loaded with plaque and you get that surge of blood going through your arteries and it rips off a piece of plaque, that plaque has to go someplace. Brain.
So she sent me to the gym to work out, and that's what caused my second stroke. Okay.
Because we were married then, it was okay.
Right, you didn't marry.
So unfortunately, that was a horrible, horrible lesson that we learned after the fact.
Yeah.
And that's why I don't want to go to the gym to her anymore.
Shame on you, Brenda.
But I will tell you, for somebody who's been, and then he did have another minor stroke only 4 years ago. Very minor, that nobody but me even picked up on. And the only reason I picked up on it was there was a day that he just wasn't feeling well. I checked his blood pressure. It was higher than normal, but nothing outrageous. And he just wanted to sleep all day. I'm like, all right, you know what? That's not the most uncommon for him to want to sleep. Next day, he woke up. He was fine. Absolutely fine. I said, let's go for a walk in the park. He said, okay. And they have a mulch trail, like a mulch fitness trail around the lake. Couldn't walk on the trail. He had already had a bad gait, meaning that he's already been right side compromised and he drags his right side a little bit, but minor. Well, it became a lot more pronounced after this minor stroke. And for somebody who's been through, like what I say, 2.5 strokes, he's fully functional. He never went back to work after the second stroke because he does have some cognitive issues, So he said his right foot is, his left foot, and it was really his right foot. He confuses some words here and there. He's now like Amelia Bedelia. Do you remember that book years and years ago? You take a man who's very creative and visual, and now he's become literal. Like the two to me just don't even match, but it's kind of funny. But
wow.
Yeah, it is. But again, look at him. He drives. It took him 6 months after the second stroke to drive, because after the second stroke, he couldn't eat any solid foods. He couldn't pass the swallow test. And then, believe it or not, up until about 1.5 years ago, if he laughed, he would choke. He started choking because his diaphragm and everything was completely, affected. However, what Larry did for us also, in a way, was he got me into a whole new business.
This is the good part of the story, because now you're going to get to the part of your story about the Med Forum and everything else really touched a nerve with me. So I did a lot of the work on that. It is the worst drug in the world.
And you were on metformin.
It's the worst drug in the world.
Actually,
now,
he was also on Janumet, right? And I'm laying there while he's in ICU from the first stroke, and I hear on the TV, if you've been taking Janumet and you've had a heart attack or a stroke, you could be part of a class action suit. And I'm like, he's on Janumet. He's had heart attacks. He's stroke. But they wouldn't take him into the suit.
I had too many.
So.
But here's what I want you to know. So Brenda, from this whole thing, winds up in a new business. A new business learning about nutrition that she has done extraordinarily well. So one, I'm going to tell you the name, and she can ship it to you so that you can look at all the information. But this stuff is called Euphoria. What are they doing?
No, you're good.
Euphoria. It is amazing. So, getting to your question of what medicines am I on? And the answer is going to be today, I'm going to tell you. In the past, I'd be embarrassed to tell you. I had so many freaking medicines that it was ridiculous. So, because of this stuff, and what they do is they do a cheek
Can I
swab.
explain it?
Go ahead.
You okay?
Okay, you explain it.
Am I
Go
good
ahead.
at this?
Go
Yeah.
ahead.
So
Tell me
basically, I went on this adventure trying to keep Larry alive. I figured, now that I married him, I should probably keep him around. I kind of liked him.
No, she figured out that I was getting my unemployment
No.
and disability.
You don't even get
So
unemployment.
I got my Social Security and my disability, and she decided, shit, you're worth more alive than dead.
So basically, and I'm going to tell you the story, Lisa. So what happened? What brought me to where we are today? I fell apart. Okay? So nobody asks, Lisa, how are you? Lisa, how you doing? Lisa, what can I do for you? Okay? You're not going to get a lot of that. Stroke number 1, I put on 51 pounds. I took off all 51 pounds when he recovered. Stroke number 2, guess what I found? The 51 pounds that I lost.
Not
Stroke.
50.
It was 51 pounds. Couldn't get that weight off. I've been lifting him up. I've been caring for him. I'm doing everything that you were doing. Yeah, you're currently doing. I already had a bad back and neck. I landed up with 5 herniated discs, a torn sacral joint, an inflammation in my body that was so severe that I got to a point a few years ago that I was laying in bed crying, it can't be this bad. I can't survive like this. And he's doing better, because I'm so good at taking care of him, right? So I start doing all kinds of research and all kinds of testing on myself, and I find out that my inflammation was off the chart, okay? I find Euphoria Science, and I do a DNA test, okay? And what we do is we test 18 actionable genes.
Hold on 1 second. The DNA test is just a cheek swab. So that's what they need. They need.
It's not blood. It's
no,
they're
cheek
going
swab,
to
but
stuff.
you have to just explain it.
Right. So what do I learn? Of course, because if I'm doing it, he's going to do it too, right? So I learned that I inherited the variant for healthy inflammation levels and weight management and various others, okay? What do we learn about Larry? Lipid, cholesterol, blood pressure, heart disease, depression, inflammation, weight management. He had more inherited genes than you would ever want to see, okay? No surprises. But this company, the reason I went with them, and I wasn't doing this as a business, I was just doing this for my own good because I was in such chronic pain, that they customize a plant-based nutritional supplement based on your actual DNA. But they customize it not just by what they put into it, but how much, down to the micromilligram. So I put Larry on it. I put myself on it. Within the first 8 months, my inflammation levels went down by 50%. My chronic pain went away. At that point, I hadn't lost anything. After the 8-month mark, I started losing weight. I lost 39 pounds, right? We start watching his blood, we start watching his blood pressure, and you know what, Larry, I got to take you off one of your 3 blood pressure medications. So this is going to answer the question that you previously answered. So he was on 3 blood pressure medications, 2 cholesterol medications, 2 diabetes medications, 2 antidepressants, and aspirin and Plavix, okay? So we started taking him slowly off some of it. Now, fast forward, I meet somebody, and he says to me, I got another product I want you to try. I'm going to make you a deal. I'm going to go on yours, you go on mine. Let's try it. And I was like, I'm feeling great. I don't need to try anything. Larry, who I never allow this to happen, he says, give it to me. I'm going to guinea pig it. Okay? This product does cell signaling, okay, which works with the mitochondria in your body to help actually cure your cells. So I put Larry on it, and he starts getting dizzy spells after a month or 2. And I'm like, oh God, here we go again, another stroke, right? So I start taking his blood pressure, because we're kind of guilty of not taking it on a daily basis anymore. And it's too low. Too low.
Wow.
He goes, I'm 90 over 60. I'm like, well, that's where I normally am. welcome to my world. He's like, I don't know how you stand up. I'm like, well, I hold on. But so I ended up taking him off a total of 2 blood pressure meds. I've taken him off his statin drugs. I've taken him off both antidepressants. And I've taken him off 1 diabetic med. And if he would stop eating and drinking the way he does, he could probably come off the other one too. But only he can control that. And I'm doing it all naturally.
Wow.
So,
that's amazing.
And we still watch him. I mean, his blood pressure sometimes goes a little higher than normal, but I give him extra water those days. You know, if I have to give him a little bit more, I'll give him a little bit more. His sugars, again, he can control that. His cholesterol, so he does take an injection. He takes that Repatha injection every other week, but taking him off statins was so huge because he was no longer having all the side effects. But what we also learned with the DNA testing is they tell you to take CoQ10 when you have, statins.
Because you have pain in your legs.
Right.
And everybody has to go with CoQ10. But nobody tells you how much CoQ10 you should have.
Or what.
In other words, now, all this is going on. I'm taking 500. I'm taking 1,000. I'm taking 1,500. I'm up to 2,000 of these doses, and I cannot take the statin drug. Can't. The pain is too great for me.
But the other option is more strokes.
Are you ready for this? So this Euphoria does the cheek swab. And all of a sudden I learned something that in all my years of doing this, do I not even read about? There are 2 forms of CoQ10. You spend your time, you can't find it. Ubiquinol and ubiquinone. This stuff gave me 50 and 50 or 56, just 50 range milligrams, and that's all I take.
And no more leg pain. But then we took him off the statins anyway because his cholesterol went too low.
Wow.
Now, I'll tell you something really sick. My heart doctor, okay, she goes ahead and says
we're going over all of Larry's meds. You go to the doctor and they always say, okay, let's go over all the meds. He goes, all right, he's on this. Now, took him off. What do you mean you took him off? I took him off. What about this? Oh, took him off that too. But after his cholesterol, he says to me, why'd you just keep taking him off of things? And I was like, because his numbers are too low. His cholesterol went down to 128. Oh no, the lower the better. Now, talking to the functional neurologist, anything for a stroke patient under 132 is actually going to do more harm than good.
Yeah.
You need cholesterol in the body, right? So I said to the doctor, an old college buddy of his, and I said, let me ask you something. You want to see what I have him on? And he goes, no. I said, oh, right, because you won't get a kickback.
Ouch.
Didn't answer me.
Okay, here's what I want to do. I want to just do 2 things because it's almost 4:00 and we have to be someplace. But do you want to just stop the tape for a second? Because I just want to talk to you.
I sure do. So thank you guys for the information that you have shared. I'm sure that actually your audience, when they see this, the information you've given has been a wealth of knowledge. So we are going to go ahead and phase out. You guys can stay on after we stop the recording and we'll chat a little bit more. Thank you guys so much. We appreciate you.
Thank you.